Welcome to this video on the assessment and care of rib fracture patients, intended for Level 4 Trauma Facility inpatient nursing staff at Ascension Seton Northwest. Admission criteria for 2 or less rib fractures include no other major injuries. Exclusions for admission to ASNW include hemothorax, pneumothorax, pulmonary contusion, or hypoxemia. Patients may have abrasions, contusions, and minor injuries to other body systems. Orders and management involve anesthesia for potential epidural placement and management. This is not a common practice here at Seton Northwest. Respiratory therapy will utilize the rib fracture protocol and document the incentive spirometry results. Further recommendations or treatments may result in initial assessment. Nursing will follow the Seton Adult Multimodal Acute Pain Management Power Plan, or pain management orders, and reinforce education on IS use, coughing, and splinting. Remember to document at least every shift. Key nursing interventions include consistent multimodal pain control, incentive spirometry use every 2 hours while awake to prevent complications like pneumonia, and encouraging mobilization when appropriate. Remember to document IS use at least every shift. Watch for and report changes to the provider, such as uncontrolled pain, fever, worsening cough, thick sputum, decreased oxygen saturation, and increased activity intolerance. Also monitor for adventitious breath sounds and subcutaneous air or emphysema. Elderly patients are at increased risk of complications. Patient education should cover medications, signs to report, incentive spirometer frequency and goals, gradual activity increase, splinting ribs during coughing or movement, and discharge instructions including expected pain duration. Nursing interdisciplinary plan of care, IPOCs, to consider include pain management, fall prevention, activity intolerance/impaired mobility, and knowledge deficit/discharge planning. Additionally, address risk for injury, risk for infection, and impaired gas exchange. Regarding incentive spirometer use, nursing does not require a physician's order to implement it. All postoperative patients should utilize an IS. The current gap is not documenting IS volumes every shift. Action includes notifying the provider for the RT-RIB FX protocol or an IS order post-op, and implementing education immediately. For any questions, please contact Marilu Harris, Trauma Program Manager, at alejandra.harris@ascension.org.